Table Viva is an integral component of both undergraduate and postgraduate examination. Unlike clinical cases, table Vivas are more objective in nature and there are really good scoring opportunity. In this video, we are going to discuss the instrument table and we have tried to make this video as realistic as possible so it can help for the purpose of all type of questions that may be asked in examination. Also, it will give you a fair idea regarding how you should frame your answers. So let's start with the video.
Identify this equipment.
So this is a lumbar puncture needle with a stylet.
Can you tell me some of its uses?
So this can be used for both diagnostic and therapeutic purposes. So if we talk about diagnostic purposes, then it can be used for CNS infections, say for instance meningitis and encephalitis. Other indications can include Guillain-Barré syndrome and subarachnoid hemorrhage diagnosis. We can also use it for myelography and CSF pressure measurement. And if we talk about therapeutic indications, then we can use it to give intrathecal medications such as methotrexate and certain antibiotics also. And it can also be used to give spinal anesthesia.
Okay. Are there any contraindication for the use of lumbar puncture needle?
So if there is raised ICP or intracranial pressure, we won't prefer to do it. Or if there is hemodynamic instability, if there is thrombocytopenia and coagulopathy, then also we're not going to do it. And if there is some local site infection.
Okay. Can you name some complications that may occur because of lumbar puncture?
Sir, there can be a post-lumbar puncture headache or a backache. We can also have infections and cerebral herniation can also occur. There can be a bloody tap or we can also have patients with nerve root pain.
Okay. And what is the most appropriate site to perform lumbar puncture?
Sir, it varies according to age. For example, if we talk about infants and young children, then it's done in the L4 and L5 disc space. However, if we talk about children who are older or there are adults, then we can have it between the disc space of L2 and L3.
Okay. Identify this equipment.
So this is Sala's bone marrow aspiration needle.
Okay. Can you name some of the indication for its use?
Sir, it is mainly used for diagnosing hematological disorders. For instance, if we talk about refractory anemia or ALL, AML, CML, malignancies of this sort. If there is ITP or immune thrombocytopenic purpura, or if we have aplastic anemia. Also, it can be used to diagnose infections such as typhoid and Kala Azar. Certain storage disorders like Gaucher's disease, and also if we suspect any bone marrow metastasis. There's also some therapeutic indications. For instance, it can be used for bone marrow transplantation.
Great. So, is there any contraindication to perform bone marrow aspiration?
So there are mostly relative contraindications. If for instance thrombocytopenia or coagulopathy, and if there is any local site infection, then we won't.
Okay. Is there any complication that may occur because of bone marrow aspiration?
So there may be bleeding from the local site, or there may be infection from where the tap is being done.
Okay. And what is the most appropriate site to perform BMA?
Sir, it again varies on the basis of whether we're dealing with infants or older children. So if it's infants and young children, we're doing it in the upper end of the tibia. But for older children and adults, the posterior superior iliac spine is the most preferred area for doing it. Other than that, we can also do it in the ASIS or the anterior superior iliac spine or the sternum.
Okay. Okay. Identify this equipment.
So this is the Jamshedi bone marrow biopsy needle.
Okay. And what are the indications for its use?
Sir, mostly this indications for biopsy and aspiration are the same, but the biopsy is done in cases where the bone marrow aspiration is failing to provide a diagnosis or is inconclusive. For instance, we can have a dry tap or extremely low cellularity, like in cases of aplastic anemia and myelofibrosis. There we would prefer doing a biopsy instead of plain aspiration.
Okay. Is there any contraindication for performing bone marrow biopsy?
Sir, again, thrombocytopenia or any coagulopathy, basically increased bleeding tendency and local site infection.
Okay. So, are there any complications that may result because of the bone marrow biopsy?
Sir, there may be bleeding from the site that we're doing the biopsy. There may be infection introduced at the site. Bone fracture is also seen in very few cases, but that's usually if there is some pathological bone disease that's associated. For example, if the child has rickets, we might have bone fractures.
And what are the preferred sites to perform bone marrow biopsy?
Sir, the same sites, as we talked about in the previous instrument, that's the bone marrow aspiration needle. For older children, there's the PSIS or the ASIS or the sternum, and for younger children, the upper end of the tibia.
And how can you distinguish between these two needles, say bone marrow aspiration and bone marrow biopsy?
So mainly the difference comes in the fact that the biopsy needle has a handle and the bone marrow aspiration needle does not have a handle.
Right. Okay. Identify this equipment.
So this is an automated biopsy gun. So,
Okay. And for what purpose do we use it?
sir, it can be used to obtain tissues from various sites for diagnostic purposes. For example, we can use it for liver disorders, kidney or lymph node or soft tissue specimens that we want in.
And what are the advantage of using an automated biopsy gun over a conventional true cut biopsy gun?
So since this is an automated instrument, so we can expect more precision. It's a rather more simplified procedure, has a better success rate, and it also causes lesser trauma to the patient.
Okay. And is there any complication that may occur during the procedure?
Sir, there might be infection due to the bone biopsy, and there can also be bleeding from the local site.
Right. So identify this tube.
Sir, this is a Riles tube, or we can also call it a feeding tube or a nasogastric tube.
Okay. And what are the indications of putting a rice tube in a patient?
Sir, it can be used to provide enteral fields. Other than that, we can use it to decompress the stomach in cases of abdominal distension or before surgery, in case of an unconscious patient, to remove blood or bile in case of a GI obstruction or bleed. And we can also use it to stop vomiting and prevent aspiration.
Okay. And name some contraindications for putting a rice tube.
Sir, it's contraindicated in cases where there is been maxillofacial surgery or any sort of trauma, esophageal tumors, or if you have a fistula or certain surgeries, if there's a basal skull fracture, or if there has been alkaline ingestion.
Okay. Okay. What are the complications of putting a rice tube in a patient?
Sir, a Riles tube can cause esophageal rupture, and there may be malpositioning also in some cases. For instance, if there is a tracheoesophageal fistula, then there can be coiling in the esophagus. There can be a possibility of airway insertion, and if there is a basal skull fracture, then there may be an intracranial insertion. Other than that, there can be epistaxis, and on prolonged use, we may also have patients with nasal ulceration.
Okay. And how do you measure the right length of nasogastric tube that need to be inserted?
Sir, it's basically measured from the bridge of the nose to the earlobe, and then from the earlobe to a point that's halfway between the xiphoid process and the umbilicus.
Right. Identify this.
So this instrument is a suction catheter.
Name some uses of suction catheter.
Sir, it's commonly used to aspirate secretions from the oral or nasal cavity or endotracheal tube also, and it can also be used to remove blood and fluid during surgeries.
Okay. Are there any complications that may result during suctioning?
Sir, there might be a local tissue trauma. If there is some clot, then it can be dislodged. There can be bradycardia if there is a vagal nerve stimulation due to the suction catheter, or if there is interruption of oxygen supply, it may result in hypoxia, and there may be instances of infection also if there is improper handling and sterility is not maintained.
Right. And how do you distinguish between suction catheter and a Riles tube?
So there are a few points of difference when we look at them. For instance, in the case of Ryle's tube, there is no opening at the tip, whereas in the case of a suction catheter, there is. There are multiple ports or holes lining the Ryle's tube, whereas in a suction catheter, there's just one side. And if we see, there's also a radio opaque line that goes on in nasogastric tube, but there is no such line in the suction catheter. So this basically is for knowing proper placement of the tube. Once we've placed it, we can use this as a guide. And so this can also be closed. This is basically closed from the top. After the feed, it can be closed from the top, whereas in cases of the suction catheter, there is no such thing. And there is a side port that can be used to basically mediate pressure, change it
Right.
according to our need.
So how do you determine that what length of the catheter need to be inserted when you are doing an ET suction?
So it basically should not be more than 0.5 centimeter beyond the length of the ET tube itself.
Okay. And what should be the pressure that we should keep when we are doing a neonatal endotracheal tube suctioning?
So a pressure of 80 to 100 mm of HA is preferred when we are doing it.
Right. Identify this.
So this is a Foley's catheter.
Okay. And name some indications to put a Foley's catheter in a patient.
So it's mainly used to drain the bladder, which can be in many situations. For instance, if we have to monitor the urinary output or there's some acute urinary retention, it can be used to relieve that. And it's also used in case of pelvic surgeries to sort of drain the bladder and prevent any injury happening. For example, in cases of cesarean sections. And it can also be used in patients who cannot go and urinate themselves. For instance, patients who are critically ill, they're bedridden, they're comatose, or they're in post anesthesia and sedation, or a patient is paralyzed. So in those cases, we can go for a Foley's catheter.
Okay. Are there any complications that may result because of Foley's catheterization?
Sir, it can cause urethral injury, specifically if it's not inserted properly. It can cause bleeding. The balloon can also rupture, so there may be a balloon rupture. There can also be paraphimosis, and if the patient is allergic to latex, then we can have an allergic reactions also. And other than that, sir, if there is prolonged catheterization, then infection can develop. There might be encrustation, and a false tract can also be created, and iatrogenic hypospadias can also be a complication.
Right. Identify this equipment.
So this is a self-inflating bag with a reservoir.
Okay. Can you name what are the valves that are there in a self-inflating bag?
Sir, there is an inspiratory or fish mouth valve. Then there is also an expiratory valve that's available. Other than that, there's a pop-off valve, and there's also a one-way inlet valve that's present.
Okay. And how much FiO2 can you provide with a self-inflating bag?
So it varies according to how we are using it. For instance, if we take the reservoir bag off, then if it's just a self-inflating bag alone, then there is a 21% FiO2 or at room air that we're delivering to the patient. But if there is a reservoir, but if there's oxygen that we connect to it, then it's about 40 to 50% FiO2. And if a reservoir bag is connected, then we're providing near 90 to 100% FiO2.
Okay. Is there any complication that may result because when you are doing bag and mask ventilation to a patient?
Yes, sir. There might be oxygen toxicity if we are providing higher FiO2 than is required for the patient. Other than that, there can be pneumothorax, and there can also be abdominal distension.
Okay. What are these?
So these are this is basically a metered dose inhaler.
Okay. And what are the advantage of using a metered dose inhaler over a conventional nebulizer?
So it's a portable and compact device, and the treatment time is very short. If we're looking at nebulization, it typically takes 10 to 15 minutes, but this is rather shorter than that. No other drug preparation is required, and every dose, metered doses are given. That means it's dose to dose reproducibility is very high, and there's also no contamination of the content during administration.
Right. And should we use it with spacer or without spacer?
So in cases of children, spaces are typically preferred because there is insurance that there's no loss of medication. It's hard to coordinate for children. If we understand how it's going to be used ultimately, there has to be particular timing of inspiration and the dose has to go in. But with children, we cannot have that, so we use a spacer instead.
Right. Identify this.
So it's an IV cannula or intravenous cannula.
So how do we know that what size of cannula is this?
So cannulas are basically color coded, and it can range from various gauge, that is various thickness of the needle also. So according to the color, say for instance this is blue, so it is a 22 gauge cannula, and that is how we can have it from ranges of 14 to 26.
Okay. And where do we use these IV cannulas?
So they are mainly used to provide IV fluids and IV medication, including certain antibiotics also. And it can also be used to transfuse blood products in patients and perform lumbar puncture in very young children.
Okay, so when you have already inserted a IV cannula in a patient, so what are the things you should be watchful for? What are the complications that may occur?
So there might be occlusion of the cannula itself, there might be leakage, there might be extravasation, thrombus can be formed, there can be local site infection also, there might be inflammation in the veins or phlebitis can also occur, and there can be pain, swelling or redness, erythema.
Right. Okay. Identify this.
So this is a mucus extractor, also called the Dilly's mucus extractor.
And where do we use it?
So it's mainly used to aspirate secretions from the oral and nasal cavity and to maintain a clear airway in a newborn.
So we already have suction catheter for that purpose. What are the advantage of having a mucus extractor over suction catheter?
Sir, there is a collection chamber in case of a mucus extractor. It can be used for further investigation like gram staining or culture or cytology. And also it does not need any electrical supply or any vacuum, so it can be used.
So is there any limitation of using a mucus extractor?
Sir, in case of a mucus extractor, the pressure cannot be regulated and that might in turn cause injury to the neonatal mucosa.
Okay. And is there any particular sequence we should follow while doing a oral and nasal suctioning?
Sir, the mouth should always be suctioned before the nose, and this is basically done to prevent aspiration of the contents in the mouth into the lungs.
Right. Identify this.
So this is a laryngoscope with a blade.
Okay. What are the components and how do you assemble it?
So it mainly has two parts. This is the handle with a light source and this is the blade with a fiber optic channel.
Can you show me how to assemble this?
Yes sir. For assembly we put it at this angle and we until we hear it click. After that we can just, and this is ready for use.
Right. And what are the different types of blade we use?
Sir, there are predominantly two types of blades that we'll be using. One of them is a straight blade and the other is a curved blade. The straight blade is also known as the Miller's blade and the curved one is also known as Macintosh blade. And the straight blade is mainly used in neonates and young children as their large floppy epiglottis can easily be lifted and we can directly visualize the vocal cords.
Okay. And which hand one should handle the laryngoscope? Is it the right hand or the left hand?
No sir, irrespective of dexterity, usually the laryngoscope is designed such that it should be held in the left hand, and the device is basically such that if you hold it with the left hand, it will provide an unobstructed view of the airway and that will allow for easier insertion. So the ET tube is basically held in the right hand and the laryngoscope in the left hand and then we intubate.
Right. Okay. Identify this.
So this is a cuffed endotracheal tube.
Okay. And what are the components of an cuffed endotracheal tube?
So this is the connector and this is the tube in itself this is the pilot balloon which is connected to ultimately the cuff at the very end here, and we also have an opening, the Murphy's eye at the very top.
And what are the advantage of having a cuff over an uncuffed?
Sir, it basically serves two purposes. Number one, it makes a tight seal and prevents the loss of pressure from the lower airway. And secondly, it also prevents aspiration of any content that's above the glottis inside the trachea. And so that's it.
And where should we use cuffed ET tube?
Sir, cupped ET tubes are not required in patients, specifically younger patients basically, while we can alternatively use an uncuffed ET tube because there is the cricoid ring in younger patients which is already enough to form a seal by itself. So the tube, the uncuffed tube is used in that
Right.
population.
And how do you determine the correct size of an endotracheal tube that needs to be inserted?
So for the purpose of determining size, you basically have a formula, and the diameter of the uncuffed ET tube is basically measured as age in years divided by 4 and plus 4.
Right. What is this?
Sir, this is a 3-way stopcock.
And how it is beneficial?
Sir, as we can see, there are multiple lines through which a single for a single intravenous access. We can see that there are 2 inlet ports and 1 outlet port, and there's also an arrow on the colored handle which is basically to indicate the direction of the flow.
Okay. And where it is advantageous for us to use a 3-way over a simple cannula?
So basically there's going to be less leakage in terms of using this, and also it saves up a lot of time that in connecting, like if we have to connect a saline flush immediately after administering some medication, so it saves a lot of time in changing and then pushing the drug.
Any medication you can tell which has a very short half-life and you need to insert 3-way and give a flush through 3-way?
Yes, sir. Sir, adenosine is one drug which is a very short life, and we have to therefore use a 3-way sort of mandatory and then give the drug.
Right. What is this device?
So this is called a Goodell airway.
Okay. And what are the uses of a Goodell's airway?
So Goodell's airway is basically used to maintain the airway of the patient, and it prevents the tongue from partially or completely obstructing the airway.
Okay. Can you demonstrate the right way to insert a Goodell's airway in a patient?
So first, obviously, we'll be measuring the size of the Goodell's airway. That will be seen from basically the corner of the mouth and to the angle of the mandible. So sort of you're going to measure it, and after that it is inserted. If the patient is say in front of me, I will be inserting it this way, and as soon as I hit the soft palate of the patient, I'll be rotating it through 180 degrees and further inserting. So this is the final position in the patient.
Right.
So I hope that this video will be helpful for all of you, and it will definitely save your time and effort while you prepare for your exams. I'm extremely thankful to Dr. Madhav and Dr. Anushruti for all the technological expertise and help they have provided while recording of this video. Thank you.